Every year, more than 400,000 patients turn to community health clinics like this in South LA and Compton. Many have jobs, but they live near poverty, while others are undocumented and some are homeless. And their vulnerability during the coronavirus pandemic could have a cascading effect on everyone in Los Angeles. Drop into South LA and your eyes may lock in on the less fortunate, and you may miss what's hiding in plain sight. People who labor to make the lives of others a bit easier, according to Jim Mangia.
Grocery workers, car wash workers, many of the folks who take care of our children.
Mangia is talking about the working poor who traditionally turn to one of the 18 community health centers that he runs called St. John's Well Child and Family Center. Tents have been set up outside the clinics to separate those who are suspected of having COVID-19 from people who are here for dialysis or routine checkups.
If it weren't for community health centers on the front lines, all of these patients would be cramming the emergency rooms in order to get tests and to get diagnosed.
The job of diagnosing on the front line falls on dedicated healthcare professionals like Dr. Jonathan Olumoya.
It's a very frustrating situation to not be able to test.
That's because test kits are in short supply.
Last week, 879 patients that we saw, we were only able to test about 100 of them. And of those 100, it was 115, there was over 21 that tested positive.
Which means about 20% of that group has been infected, which is why lower resource physicians are worried about a potential domino effect beyond the communities they serve.
We don't mitigate this. The ICUs are going to run out of beds, run out of ventilators. People are going to be refused care.
And that is only half of the story. Mangia says despite promises from Washington that help is on the way in the form of personal protective equipment like masks and gowns, he's had to strike deals with companies in China to hopefully get his staff through the end of April. Last week, some workers at this clinic had only one mask for the entire week.
The federal government has clearly failed, and they have the capacity to mass produce and force mass production of the things that we need on the front lines.
But without enough testing, it's not just the healthcare system that's strained. He says patients aren't able to work because they have to self-quarantine, not knowing if they have the coronavirus or simply suffering from the flu or the common cold.
It's kind of like instead of using a scalpel, we're using a hatchet.
In LA County alone, more than 350 community clinics and healthcare centers like this provide primary care and services to about 1.7 million patients a year. In South LA, Jeff Nguyen, KCAL 9 News.